This is a 41-year-old woman who had a stroke 6 years ago and now has some atypical chest pains. When she had the stroke, they found that she had a PFO, or Patent Foramen Ovale, and she had an occluder placed. These are images of her coronary arteries in 3 dimensions. There are a few minor slice registration artifacts, but it's a very diagnostic examination. And as might be expected in a 41-year-old woman, the coronary arteries are entirely normal. The most important aspect, of course, is looking at the site of the previously placed occluder. This is an image through the interatrial septum. You can see the opacified left atrium and the somewhat poorly opacified right atrium. You can see the device in the interatrial septum in the appropriate position. I can thicken this up a little bit and start looking at this a bit more dynamically by doing some cross-sectional imaging, and this allows me to then look at both the one view as well as an orthogonal view by going about the surface. It's probably a little bit better, however, if we just thicken up the whole MIP here and allow us to look at this by rotating it about 90 degrees. You can see that this looks like a sort of a combination of two connections that are really spiraling around each other. It's difficult to tell what type of occluder this is. I think I know what type it is, but I don't have the operative report. There are a variety of various occluders. They are placed in sort of a clamshell type situation using an approach through the veins using a transeptal catheter to place the instruments. This is a extremely well-placed instrument. I believe it's a CardioSeal device. Like I said, there are many other devices available for insertion.